We are here at the conference Deliberation and Transformation Challenges Through the Ethics of Care in Stuttgart, October 2013. And I'm very happy to be here with Professor Elisabeth Conradi, one of the organizers of the conference. Welcome. Could you tell us a little bit about yourself?
I'm Professor of Philosophy and Social Theory at the Dual University in Stuttgart. My teaching fields are social philosophy, ethics, anthropology, and social theory, and civil society. And I'm, as a researcher, a political scientist.
Okay, thank you. And today we had many lectures and discussions. What do you think of the conference so far?
We had a lot of disparate themes which can be seen as connected through the umbrella of the ethics of care, thematizing topics like relationship and emotion, experiences, and the interaction between moral agents. We have had discussions about politics and ethics. I personally was very interested in the panel on technologies. We had a little paper on care robots, something which is researched on in Stuttgart by the Fraunhofer Institute, and the question whether a care robot can develop something like empathy, and what makes the difference between a washing machine and a roboter. So whether we should this machine differently because of its appearance, human-like appearance. We have had a lot of interesting discussions on further research in fields like teaching ethics, in fields about how to care for elderly people, and a lot of other new research fields which we are trying to develop in the next years. I was especially interested in a paper on the question of moral imagination. So whether the person who deliberates with others need to take the role of the other, and how this role-taking is done by the imagination of the deliberating subject.
Okay, thank you. The theme of conference is deliberation and transformation. What are areas where you think transformation is necessary, or what kind of transformation would you like to see in the upcoming years? Maybe, both research and for the field ethics of care.
Yeah, so I think transformation need to be conceptualized on different levels. So on the personal level, the institutional organizational level, and on the level of politics. And one of our main topics is to bring care from the periphery to the center, and to establish something what we call need interpretation, with what is the term brought up by Nancy Fraser in the 1980s, and did not yet take place in politics. The transformation on these different levels, in my thoughts, need to be coming out of the practice and not being implemented by researchers, but being a process that is developed in the practice and taking up from the researchers. And in the research field, the transformation is difficult to think, because the ethics is traditionally a field of philosophy where you start with the moral agent, and if you want to reach societal structures, it is a different task. So we need to do more research on the bridge between the personal and the political, and especially between the moral acting and the structural transformation.
Okay, thank you very much.